Good evening, everyone. Welcome to Scotland at 7 with me, Gordon Ross. It is the 22nd of February today, and joining me on this evening's programme, we have Councillor Graham Campbell. Welcome to the programme, Graham.
Good evening, Gordon.
All right, it's nice to see you. And also joining us this evening, an old friend, Carey from Democrats Abroad. Hi, Kat.
Hiya, how are you doing today?
Oh, not too bad, Kat. Anyway, I'm going to get on with the coronavirus update first of all, and then we'll come to the news headlines. So, as of 2 o'clock today, a total of 1,660,232 people in Scotland have been tested through NHS Scotland labs and the UK Government's regional testing centres since the beginning of the pandemic. Of these, 1,462,048 were confirmed negative. 198,184 have tested positive. There are 715 new confirmed cases of COVID-19. This will be an underestimate of the numbers. Not everyone with the virus will display symptoms, and not all those with symptoms will be tested. There were no new reported deaths today of people who tested positive. The number of patients in Scotland who have died from complications caused by the coronavirus COVID-19 infection now stands at 6,950. This number includes those who have died having received a positive test for the virus in the previous 28 days. Of the people who have tested positive, 1,141 were in hospital last night, 99 of whom were in intensive care. Now, as of 8 a.m. this morning, 1,445,488 people have received their first dose of the COVID-19 vaccination, and 37,000 have received their second dose. The latest UK daily figures published today show that 120,757 patients who tested positive for COVID-19 have sadly died from their illness, an increase of 178 since yesterday. This number refers to deaths in all settings, not just hospitals. And now to tonight's main headlines. The Scottish Government vaccination drive has linked to a big drop in hospital admissions. Scotland's vaccination drive appears to be markedly reducing the risk of hospitalisation for COVID-19, suggesting that both the Pfizer-BioNTech and the Oxford-AstraZeneca shots are highly effective in preventing severe infections, preliminary study findings showed on Monday. The results of the study, which covered the entire Scottish population of 5.4 million people, showed that by the fourth week after the initial dose, the Pfizer and AstraZeneca vaccines were found to reduce the risk of hospitalisation by up to 85% and 94%, respectively. These results are very encouraging and have given us great reasons to be optimistic for the future, said Aziz Sheikh, the professor at the University of Edinburgh's Usher Institute, who co-led the study. Sheikh cautioned at media briefing that the results are preliminary data and yet to be peer-reviewed by independent scientists. But he added, "I'm very encouraged. We have national evidence that vaccination provides protection against COVID-19 hospitalisations." The data for the vaccine's effect in Scotland was gathered between December the 8th and February the 15th. Researchers said that during this period, 1.14 million vaccines were administered, and 21% of Scotland's population had received the first dose. Amongst those aged 80 years and over, one of the highest risk groups for COVID-19, the vaccination was associated with an 81% reduction in hospitalisation risk in the fourth week, when the results for both vaccinations were combined. Now, Graham, let me come to you first of all this evening for this. Now, obviously, there are new reports coming out all of the time, but this is very encouraging news, isn't it, that both AstraZeneca and the BioNTech vaccines are effective in keeping people out of hospitals. Surely this is great news.
It is indeed great news, and obviously it means that our hospitals are not being overwhelmed, that the NHS is able to cope with its obviously the regular health work that it needs to, but it's not being overwhelmed by cases in numbers that it can't handle. And obviously fewer people are getting seriously ill and dying, which is a very encouraging sign, and that what we're doing in Scotland is working in terms of controlling the virus. However, I do have a couple of concerns, which maybe education workers present listening will agree with me on. I've been listening to deep Gudasari on this one. I do have some concerns about whether we're sending schools back that little bit too early,
Mm.
but we'll come on to that.
So, do you feel that the British government's plan to send everybody back at once is not a good idea, Graham?
I think it's extraordinarily reckless. Obviously, in Scotland, we've shown that the statistics demonstrate that children aren't great spreaders of the virus, and that teachers, as a profession, aren't necessarily. There's no scientific evidence to show that they are more susceptible or more likely to get this virus than other sections of the workforce. That said, though, I would like to see teachers in terms of the next cohort of people who are vaccinated. I like to see teachers and nursery workers in that next cohort. Some worrying signs are that children who do catch a virus, and all that's quite rare in Scotland, many more of them seem to be suffering from long COVID, and we don't yet know what the effects of that are in the longer term. We also need to sort of be clear that the health and safety audits of buildings that teaching and education is occurring in, that there's proper ventilation, that the health and safety audits work, and that they can be safely operated in terms of social distancing and ventilation. So I just, with those cautions and hazards, I've heard scientists and politicians say that they do expect in the UK a rise in the R number as a result of schools going back. And obviously, we want schools to have other social reasons that it's good for kids to get their education in a proper environment of learning. But we also need to make sure it's safe. And I want to make sure that we've listened to teachers and crossed all the I's and the T's as we reopen.
Okay, thank you, Graham. Let me come to you, Kat. What Graham was saying there is interesting, that he's still worried that children, of course, are more spreaders of the disease. They don't seem to be affected by it in as big numbers. But Graham was saying that when they do catch the disease, they seem to get the long COVID version, which nobody really understands properly yet. Kat, how much... How do you think the Scottish Government is dealing with it? Are they doing a good job? Are they right to just send back the 1, 2, and primaries 1, 2, and 3 first, and then keep an eye on things? Would you say that was a cautious enough approach?
I'm afraid, as a parent, because I have one child that's back in school and I have one child that is still at home learning, I've really tried to take a step back and just allow the professionals to do their job, because even though I have an opinion on pretty much everything, I have all the respect for the teachers and the people who have been working so hard. I do know that this time when the kids were sent back to school, or my daughter's sent back to school, they closed down the streets. They had these safe walking things. My daughter had a mask with her. She had one extra break outdoors. So I think that it was very good and necessary to send back just the younger kids at first, the kids that need a little bit more practice and stuff like that. And I think that they are taking a lot more precautions right now than even before. And it's not that they didn't take precautions before, it's just that they're a little bit more practiced, and I have every hope that they'll have this under control and managed.
Okay, thank you, Kat. Well, the next story, of course, is about the phased return of children to schools in Scotland. Primary 1 to primary 3 pupils are back in Scottish classrooms today, but the Scottish Government has insisted that we'll phase the return for other year groups rather than follow the English model of reopening schools to all pupils at the same time. Scotland's First Minister Nicola Sturgeon said a very careful and cautious restart to schooling would allow the government to monitor COVID infections and to make sure that they did not start climbing again as classes resumed. Nurseries, preschool children and some teenagers sitting practical exams also returned to school today. The First Minister said that the first phase of pupils returning to school would not be before the 15th of March. She said the impact of lockdown on children was horrible. It's awful. It's probably the worst thing about this pandemic apart from the death rate. With the current community infection rate believed to be between 0.7 and 0.9 in Scotland, she said there was not enough headroom to allow further relaxation at this time. Now, Graham, it's interesting the language that the First Minister is using. She's acknowledged that it's horrible and that children seem to be suffering disproportionately from being isolated from friends, from their education, and from getting enough exercise. Do you agree with the First Minister? Is the impact on children greater, do you believe?
Well, not only is it greater, but I believe that kids in the SIMD zones, the poorer neighborhoods and poorer income households, particularly kids who are multiple children, I've got siblings in the same household trying to use one computer for the whole house while trying to access online. They've been massively disadvantaged in their education, as well as being, cooped up indoors in a house that may, not necessarily be fully the right size for their family. So definitely working class children and people from poor backgrounds have been even more disadvantaged in this crisis. So I would, obviously we want to get them back to school, but we want to do it safely. And my caution really is that I think we should even consider, we are in effect in Scotland doing a different thing to the UK. We are closer to what I would call a zero COVID elimination strategy for the
Yeah.
virus, whereas in England they're still following the herd immunity strategy of managed control of the virus rather than elimination. We are in the position in Scotland to move to one nation, and I would like to see that happen, and therefore reopening anything should be contingent on actually eliminating the virus. But we also need a proper test and tracing system. Until we can properly test, trace, and isolate means paying for the wages of the people who stay at home who are otherwise risking themselves by going to work. We need to be able to pay for that properly. And, clearly the UK government's not intending to do that. And that may mean that there's little room for manoeuvring. The worry I should have really is on the R rate. 0.7 is still quite high. And if we're between 0.7 and 0.9, that one is the point where you start having exponential spread of the virus. So we not only cannot afford to open more quickly than that, I believe that we should even be considering masks for the 6-year-old plus and onwards in schools to make sure we control as much of that community transmission as we can while people are returning to school.
Okay, well, thank you, Graham. Turning to you now, Kat. Graham just mentioned the idea of younger children wearing masks. Now, up until now, we haven't seen that, have we? I mean, I go to the supermarket, I'm sure like everyone else, and you see lots of parents with very small children and toddlers who are wandering around who don't have any masks. And you think, that doesn't seem right. Why are the children not being protected? Would you agree that perhaps it's time that children were afforded the same kind of protections as the adults?
I do. Well, my children are 6 and 9, so I was lucky enough to not have toddlers during this. And there's also the issues with if you have to go in the store with your children. I think that it's a very fine line. Like 6-year-olds, 5-year-olds, 4-year-olds, even. I think that it would be perfectly fine. I mean, you can sell mask wearing as a neat, fun trick, sort of thing. It's just about supplying the masks and making it affordable for everyone to do so, to wear them. But I do think that that children are probably able to wear them to a pretty young age, not infants. But we have to make sure to take into account, like Graham said, poorer communities, working class communities, single parents, people that have to take their kids everywhere, because what else are we going to do in this situation? So, if they have, I think that we need to have something in place to make sure that kids get masks. Maybe that is issuing them in nursery and in primary school, issuing them so many masks a week so that it's affordable to families.
I was going to say, Kat, one of the ideas that sort of leapt to my mind there while you were talking is exactly what you just said, which is the idea of the school or the kindergarten giving the mask to the children when they come in. So they got a fresh mask when they come into school. And those masks can be disposed of when the risk is over, when the children are back out in the fresh air again. It's only really when they're indoors that the risk is at its height, isn't it?
Right. I mean, and kids aren't under the same social distancing rules, but I know that this entire school year, since they've been back in school, even before the break, they were outdoors more often. They were doing a lot more classes, just constantly outdoors as much as they possibly can. And then they also limited who they had contact with inside the schools. So I think that we should really acknowledge what a great job that the schools are doing and the teachers. I mean, I have friends that are teachers and they are just working so hard right now. And I do think that anything that makes their lives a little easier and more affordable for the parents, that's probably a good way to go.
Okay, Kat. Well, let's move on now. And the SNP say that a £98 billion fiscal stimulus is needed to protect jobs and incomes. The SNP has called again on the UK government to introduce a 5-point plan to kickstart an investment-led recovery at the budget next week, warning the Chancellor not to pull the rug out from underneath the economy when it needs maximum investment. With 9 days until the UK budget, Ian Blackford MP has written to Rishi Sunak to urge him to ditch plans for a return to Tory austerity cuts and instead to deliver a major fiscal stimulus of at least £98 billion, the equivalent of 5% of GDP, to prevent a prolonged downturn and mass unemployment. The SNP Westminster leader said it was increasingly clear that Scotland faces a choice of two futures, with the long-term damage of Brexit and Tory cuts at Westminster, or the opportunity to protect Scotland's place in Europe and to build a strong, fair and green recovery as an independent country. Ahead of the budget, the SNP is calling for the Chancellor to introduce 5 key measures: a £98 billion fiscal stimulus to kickstart an investment-led recovery, with investment focused on creating jobs, boosting incomes and a green recovery; to extend the furlough scheme and to plug the gaps in support, including a package for the 3 million people who have been completely excluded for a year. Also to tackle child poverty and boost household incomes by matching the Scottish child payment across the UK, ditching the Tory public sector pay freeze, making the £20 uplift to universal credit permanent and extending it to legacy benefits. The long-term investment for the NHS, matching the Scottish Government's £500 thank you payment, delivering a pay rise for the health and care staff, and increasing NHS funding to a higher level per head in Scotland, delivering an extra £35 billion for NHS England and £4 billion for NHS Scotland in Barnett consequentials. And finally, a multi-billion Brexit compensation package for Scotland, mitigating the damage done by Boris Johnson's deal and following the EU's €1.05 billion for Ireland. Now, first of all, let me come to you, Graham. We spoke earlier on there, or rather you did, about the fact that with more money available to help mitigate the worst effects of COVID and Brexit, Scotland could do a lot better for its children and for everybody else. This call from the SNP, this is not the first time they've made this call, is it?
No, it's not, and obviously, in terms of the way capitalism works, the government is in a key position, the UK government that is, to inject cash into the economy and to stimulate economic activity in circumstances like this, and it's done that at the end of every crisis. The trouble is that it tends to do so in a way that benefits the rich and not benefiting the people who actually need to make a living and to make an income from either small businesses or etc. We've tried in the tax proposals we've proposed in the current Scottish Government budget to obviously increase those thresholds, obviously pay public sector workers more, but also try not to catch that back by having tax thresholds that catch them out. So we've actually reduced their tax burden as well, so that they actually keep the money we're giving them. So we would like to see that as well. That obviously stimulates the economy because it increases spending power. It increases the bang for the buck for that dollar going into the local communities to help their local shops and businesses. It should allow us to properly keep the economy ticking as much as we can in the limited circumstances we have. But I suppose the key thing is, they want to impose the costs of that crisis on ordinary people, ordinary working people. We don't.
Yeah.
We want a fairer outcome, and that's why we're proposing those measures, because those will ultimately be more productive and actually not counterproductive, which is what austerity is. Austerity doesn't work. All those times they told us for the last 12 years that, oh, it's absolutely essential to have sound money. Here they are borrowing more money than ever before by any government in peacetime. So they could do it when they want to, and we
Yeah.
have to force them to do it in a way that's compatible with a fair economy.
Okay, thank you, Graham. Kat, the idea of spending your way out of a disaster is not a new one, is it? And the Bank of England, uniquely, is basically the bank for the whole of the United Kingdom, isn't it? And it's a bank that can create currency and then lend it to the government. So the UK government really doesn't need to foist the costs of the COVID catastrophe on the taxpayers, do they?
I think it's not only do they not have to, I think it's really important that they don't. And with everything in the news about the contracts that are going out to companies, the cronyism in the UK government, I don't think that they have a leg to stand on. I don't think that it's necessary, and I think that that needs to be highlighted and brought home. And we just need to keep that in mind as we push, and we need to keep the political will to push for that.
Okay, Kat, thank you very much for those comments. And now to our next story. The Scottish government, the Scottish government's tax plans, I beg your pardon, means that Scottish NHS workers will actually earn more than their English counterparts. A host of public sector workers in Scotland will earn more than their equivalents in Tory-run England after the SNP's tax proposals for 2021-22 take effect, according to new analysis. The new figures, released by the Scottish Parliament's Information Centre, have revealed that a hospital porter at the top of Band 2 NHS pay scale will be £1,036 better off than their English equivalents. Meanwhile, a staff nurse at the top of Band 5 will be £785 better off. Emergency services staff in Scotland will also benefit from the SNP's proposals to freeze income tax at current levels, with a Band 6 paramedic receiving a higher salary after tax than those in England. A police constable at the top of their pay scale will also be £735 better off in Scotland. Now, Graham, this is always an interesting thing to compare and contrast the pay being given to Scottish public sector workers and to compare them with those given by the Tory government south of the border. How do you feel about this? Do you think this differential should exist, or should the British government bring their pay levels up to the same as Scotland?
Well, the latter. Scotland so often in the past is setting the standard, and in fact setting the precedent for other governments to follow. It was us who put in minimum pricing of alcohol. We banned tobacco smoking from public spaces. We did a lot of things which others have had to and saw the necessity to follow. And this is another example of that. It's pretty straightforward. Why should the public sector workers, particularly in the health sector, who we've all clapped for and in many ways have been patronized by politicians for all the brilliant work that they do, and I'm not going to join in that politician-y phrasing mongering about it, but if we're going to laud that section of the workforce, then we have to back that up with cash to recognize that we take their contribution seriously, and that's why it's fairness, and that's why we've proposed a proper pay structure. And we think that English health workers deserve that too, but unfortunately they have a government that doesn't care about them in the same way that our government cares about its population. But imagine if that's what we can do when we're limited by having a very fixed budget. We have to set a balanced budget every year. Our parliament has done so for 22 years. Despite not being able to borrow, our government's been able to deliver greater pay in conditions and a better health service which performs better despite the limitations. Imagine what we could do with full powers of independence. So
Indeed,
that shows you.
Yeah, Graham, that's definitely something to conjure with. Kat, what Graham's saying obviously is, think what we could do if we had all of our powers. I was just thinking though, before I came to ask you a question, that this competition between governments is a little bit like the kind of competition you get in private enterprise, where one company is competing to do something better than another or cheaper than another. In this case, we've got governments competing to deal with things better or to be kinder to their public service staff. Do you think that this kind of governmental competition is a healthy thing? And if it is, shouldn't maybe the Barnett consequentials work in both directions?
I don't know much about the Barnett consequentials enough to
Yeah.
discuss it, but I do think that it's very important that we hold on to what budget powers that we do have, and I don't want the UK government to overreach into Scotland's business any more than they already do. Whether or not this is one of the main points I bring up when I talk about independence to people that are in England or in Wales or in Northern Ireland, is that, it shouldn't be this way. It shouldn't be this, well, we do this better and we do that better, or the unionist versus indie. It shouldn't be that way. We should be working together. However, it's not something you can really force, is it? It has to
No.
come about organically. So if Scotland is treating its workers, its healthcare workers, the way that Scottish values demand they be treated, and that those don't match with English values, then that's just the way it is.
Mm. Okay. An interesting point of view, Kat. It's always nice to hear a point of view which is different. Anyway, let's move on now. The next story. Boris Johnson is being urged to match the Scottish Government's quarantine rules. Ian Blackford MP has urged Boris Johnson to match the Scottish Government's quarantine rules and not to risk the sacrifices made by people across the UK failing to introduce adequate measures for international travellers. Responding to the Prime Minister's statement this afternoon on COVID-19, the SNP Westminster leader said that the UK government's rules for travellers arriving in the UK risk leaving the UK exposed to international variants of the virus. The YouGov polling from last week showed that only 18% of the UK government's current rules on quarantine that only 18% of people support the UK government's current rules on quarantine, while 72% of people across the UK prefer the Scottish government's approach. In Scotland, international travellers are required to quarantine in a hotel for 10 days. However, in England, it applies only to travellers from red list countries. Now, Graham, what is a red list country exactly, and why is it only in England that this rule of red list countries applies?
I have to say, I don't know what is the criteria for the countries to be considered red list. I don't know if it's if they have the particular presence of the variants that are more dangerous and more communicative. But why only those 33? Because, of course, anybody who's from a red list country can easily travel here from a country that's not on the red list. And that's the point. Viruses don't respect passport boundaries and borders. Viruses can travel borders, and it's not, as we if you watch that Trump documentary, the first 50 days of the COVID pandemic in the United States, and all the mistakes that were made. He banned travel from just one country. He red listed China. He called it the China virus. People came from all over the world to the United States, and then it spread in the community within the United States without properly being, people flew interstate, and that spread the virus. So it wasn't just external borders that needed to be concerned about; it was internal ones as well.
Yeah.
It's obvious that if you have a virus that's that dangerous and a mutation version of the virus that's that dangerous, there should be a complete lockdown. And the fact is that we can't properly close our borders in Scotland because we don't have full powers of independence. Yes, we could technically, for health reasons, block the border, but that would be political, and we then have to have the capacity to put police on the border, and we just don't have that. So the reality is we've got a backdoor of people potentially bringing the virus to Scotland, which we don't have the full powers to control, and that's the reality. And we're not going to shy away from that. That unfortunately, the English government's policy is undermining the attempt to have a proper control of the virus by the Scottish government.
Okay, Graham. Thank you for that. Kat, just bearing all what Graham has just said in mind, it seems, at least on the on face of it, really, that the British government's sort of approach to this is to try and leave some air corridors open. Now that suggests that they are caring more about the airlines and the traveling public being able to get around and to make money for the airlines and the airports than they are about safety. Would you say that this attitude from the English government is more driven by money and not by public safety?
I think it has to do with that. I think it probably also has to do with international relations and this sort of working relationship that the nations have. A lot of the countries that are red listed are poorer countries, and I think that that's very problematic. It just kind of shows that if a country isn't going to be giving money, or it's a very transactional way of dealing with it. It's not about public health. It is more about what can you do for us, then we'll let you inside our borders. And I mean, that's something that I am not supportive of at all. I think that the Scottish government can't do it, and Lord knows the UK government won't, but I really wish they would be worried about the health as much as the money, I suppose. And it is important to keep these industries going as much as they can, but they talked about ballet dancers and artist retraining. Maybe we can retrain some airline pilots too.
We never know. It might
Well,
come to
I don't
that,
want
yeah.
to be completely unkind to airline pilots, but I think there is a genuine problem that we're an island. We should have been like New Zealand and Australia, should have been able to control this virus to the point of
Yeah.
elimination. They did that by properly shutting down their airports and to all countries' travellers. We should have done the same. And the fact that
Yeah.
we haven't is a criminal act by the UK government against the population of here and also the rest of the world.
Well, that is a view I've heard from other people, Graham, so I dare say that there is something in that. Anyway, we're going to move on now, and speaking about poorer countries brings us to our next story. Oxfam has warned that the UK military support is prolonging the Yemen war. The SNP has renewed calls on the UK government to immediately end its military support and arms sales to Saudi Arabia after Oxfam warned that UK support was prolonging the devastating war in Yemen. Oxfam's head of policy and advocacy, Sam Nadell, said that as the US has called for an end to the conflict in Yemen, the UK is heading in the opposite direction, ramping up its support for the brutal Saudi-led war by increasing arms sales and refueling equipment, which facilitates airstrikes. Nadell said that the UK claims to support peace in Yemen. Well, it can start immediately by ending the sale of all arms that risk being used against civilians and exacerbating the humanitarian crisis. Earlier this month, the Biden administration announced that it would end American support for offensive operations in Yemen. However, the UK rejected calls from the SNP and other opposition parties to follow its lead. So, Graham, here we are again, the British government refusing to stop selling weapons to a country which is waging a war against essentially a poor country, isn't it? And yet the
Yes.
Americans have decided they're going to stop selling arms. Why are the British government not doing the same?
Because the British establishment that they represent is tied into those arms exports to reactionary regimes. And this has been a long-standing policy towards Saudi Arabia. The British have a key role in creating that reactionary dictatorship and to fostering its place in international relations now. And obviously the fossil fuel dependency of the international economy and the Saudis' key role in that is why they sell arms to them. Now, poor Yemen is the victim. It's the poorest country in that region. It's right next to all of these countries, which are basically fighting proxy wars over their territory. The Yemenis need to be left alone to clear up the mess, and they should be helped by the international community. They should be bombed with aid, not with Saudi weapons and not with British weapons. So the British government needs to be forced to stop selling arms to Saudi Arabia's corrupt regime.
Fair enough, Graham. That's a very concise and simple message. Kat, would you agree with Graham that it's time for the UK to stop selling arms to the Saudi Arabians?
Absolutely. I think that it's It can also be looked at as a Brexit dividend, not that it was caused by that, but the inability or the situation where it's not as easy to withdraw support from your partners that you already have. That's something with being more
Yeah.
of an inward looking, less international sort of country. So I think that they need to stop immediately.
But you think, Kat, that the pressure is on the UK government to keep or even increase arms sales to compensate for the loss of other exports due to Brexit?
I don't know if it's directly because of that, but when you lose a lot of your trading partners, you don't really want to lose the remainder of them.
I
So
guess
that's
not.
who we're in bed with now, is the Saudi regime.
Okay, so basically, the number of friendly trading countries that we're left with is countries including places like Saudi Arabia. Okay, well
Unfortunately, yes.
let's move now to America, and the U.S. Supreme Court has paved the way for the release of Donald Trump's tax returns. Donald Trump suffered a major setback on Monday in his long quest to conceal details of his finances, as the US Supreme Court paved the way for a New York City prosecutor to obtain the former president's tax returns and other financial records as a part of a criminal investigation. The justices, without comment, rebuffed Trump's request to put on hold an October the 7th lower court ruling directing the Republican businessman turned politician's longtime accounting firm Mazars USA to comply with a subpoena to turn over the materials to a grand jury convened by Manhattan District Attorney Cyrus Vance, a Democrat. The work continues, Vance said in a statement issued after the court's action. Vance had previously said in a letter to Trump's lawyers that his office would be free to immediately enforce the subpoena if the justices rejected Trump's request. The Supreme Court, which has a 6-3 conservative majority, including 3 Trump appointees, had already ruled once in the dispute last July, rejecting Trump's broad argument that he was immune from criminal probes as a sitting president. Unlike all other recent US presidents, Trump refused during his 4 years in office to make his tax returns public. The data could provide details on his wealth and the activities of his family real estate company, the Trump Organization. Now, I'm going to come to you first, Kat, for this one. I know this is more in your backyard, as it were. Now, how long have they been going after Donald Trump's tax returns now? It seems like a long time.
Yes, I think that they've been going after Donald Trump's tax returns long before they're going after President Trump's tax returns, former President Trump's tax returns. But even though this is something where, regardless of what you feel about Donald Trump, we have to be really careful about both about having accountability, having the proper level of accountability, and causing politicians to show their tax records, and also it cannot be a device for them to go after any politician that they want. I'm very happy that this is I'm not happy about this, but it is an outlier. Trump did enough things that were not by the books that I think that they really can just allow them to follow the law without, giving him any special compensation or special left out of it. But that would be my major concern, is that this couldn't be used against every politician that was in office in America. But I don't think that's the case, and I'm really happy to see, and I think the Supreme Court will uphold it, will continue to uphold
Okay.
the
Can I ask
legality
you
of it.
one more question, and that is, it says that Donald Trump is the first president who hasn't revealed his tax accounts. Is it a requirement under the Constitution for a president to have that level of transparency?
It's not. It's not in the Constitution, and I don't think it should be in the Constitution. And it just kind of shows how strange Donald Trump was, and I'm really glad that they're holding him as an example of what not to be as a president, whether they're conservative or they're otherwise in the U.S. It is really important, and most people, when they're running for president, they'll divulge their medical records. That is also not in the Constitution, and it should not be, because that's something of a personal freedom that you should have. But if it's a sign of good faith, and it's a sign of honesty. And I
Yeah.
think that that continues to be something that presidential candidates will do.
Okay, thank you, Kat. If I could come to you, Graham. Donald Trump has so far refused to reveal his tax accounts. You often wonder, though, when somebody won't allow the proper authorities to have a look at their tax accounts, that they must be hiding something. Do you think that's the case with Mr. Trump?
It undoubtedly is, and I can say that without fear of being sued for defamation, because he has formed from well before he was president, in terms of the manner in which he financed his real estate businesses, his casinos and gambling dens, and Atlantic City in particular, his first big one, first big Trump thing.
Yeah.
He borrowed lots of money from people in ways that we would now regard as racketeering, and he's claimed to only earn a certain amount of money, which is ridiculously low when we know when he's at the same time boasting of being a billionaire. So
Yeah.
a billionaire should be paying some serious hundreds of millions of dollars in taxes. He's consistently avoided tax payments. In fact, has been a tax subsidy junkie in all of the places he's built his empires with his big name on it. So he is the worst example of this, but though he's not the only one. And so it's not, as Kat said, it's not the fact that he should or shouldn't keep his tax returns private. It's he's keeping it private because he has something to hide.
Well, I guess we'll find out eventually when it comes out in the wash. Okay, we're going to move on to our next story now. And 90% of Scots are apparently happy with the new social security service. The SNP has said that a new survey, which reveals that more than 4 in 5 clients feel that Scotland's social security agency treats them with dignity, fairness and respect, shows that the people of Scotland shouldn't be forced to accept toxic Tory policies. Over 3,000 clients took part in a Social Security Scotland survey, with 90% of people rating their overall experience as very good or good. Some of the feedback included clients describing their experience as compassionate, first class, and accessible and professional service. So here we go, Graham. The Scottish Government getting on with the day job, and its first go at establishing a social security agency seems to be a major hit.
I'm delighted to hear this news, and as I can tell you, as somebody who grew up in care and who grew up with a mum who had to often go and visit social security offices in the 1970s, I remember how demeaning and humiliating it was from a very early age. So the fact that we've set up an institution that not only respects the dignity of claimants, but actually has got great feedback from people applying for those social security services, that's really good to hear, and it shows that it can be done differently, and that you can have decent, civilized, humane social values at the heart of a benefit system.
Thank you, Graham. Kat, what Graham's saying there is having these values at the heart of a social security system. I mean, many years ago, I thought myself, that social security should be more tailored around the individual. And this new system that the Scottish Government set up seems to do just that.
Well, the measure of a society is how they treat their most vulnerable. And I'm really glad to hear that this is working so well for the people that it's meant to work for. And I can't help but just echo what Graham said, is that I'm just over the moon from this news that this is working and working well and doing the day job. And I can't help but think that this is as strong of a campaign point for independence as any march or any speech or anything.
Yeah.
This is why the support for independence is so high and will remain so.
So it's a glimpse of a potential future then, Kat.
Let's hope so.
Okay, let's move on now. And the launch of a £7 million Equality and Human Rights Fund. A new £7 million fund has been announced to improve the equality and human rights of people in Scotland. It will support work which advances human rights, promotes equality, and tackles discrimination around age, sex, sexual orientation, gender reassignment, disability, and race. The fund will remain open for applications from today until the 14th of May and will cover projects over the next 3 years up to 2024. The Equalities Minister, Christina McKelvey, said this fund will support the vital efforts of expert organisations to break down barriers, empower individuals and communities, and to build a fairer Scotland which has equality and human rights at its heart. Now, Graham, I know this is probably a subject very close to your heart, but to hear of another fund being set up by the Scottish Government to help organisations to break these barriers down, how important is that, do you think, in Scotland in 2020?
Well, in
2021,
2021, I would say that it's. Don't worry, we did notice. Obviously, 2020 was a big year for Black Lives Matter, which I've got behind me, and being more aware, more public awareness of race inequality in Scotland. The denialism that probably preceded that in terms of public institutions reacted to accusations of institutionalized racism, the institutional practices they have that disadvantage Black Scots, was basically not really properly discussed until the last couple of years. But Black Lives Matter has given us that wee bit of a push to recognise them a bit more. That said, this is the first time I'm actually hearing that there is a fund. And that's somewhat telling, given that I'm a community activist. I'm the only African Caribbean councillor from my party in the whole of the country, and I'm a national officer for the BAME community on the executive of the party. Yet this is the first I'm hearing about an equalities fund, of which race is just one of the aspects.
Yeah.
Now, the reality is race equality has been deprioritised for 2 decades. In this country. And there's a good reason for that, because we passed Equalities Acts which deal with very much neglected aspects of equality, like disability and gender, of course, and sexuality and religion. These have been underrepresented parts of the equalities landscape, and they needed some work on them. But unfortunately, race equality is a bit more intractable. So I have to say that this amount of money is not going to make a lot of difference to race equality, and which how big amount of the pie race equality will get, I'm assuming it will be about 1/7 or 1/10 of that very small amount of money. So to be dead honest, it's not going to make a lot of difference.
Okay, Graham, but maybe it's a start, but it's obviously a drop in the ocean. But we are coming to the end of a government term at the moment, so maybe there's not that much left down the back of the SNP sofa at this time of the year. Anyway, let's come to you, Kat. So we're hearing now of another fund being set up by the SNP. They seem to set up a lot of funds, actually, to help people. But it's interesting that Graham was unaware of this one. Perhaps this is something so new that we've only just heard about it today. But how important is this in the future Scotland in terms of when we become independent?
I think it's really important, and like Graham said, it might not be enough money, and maybe it's because that we're in the middle of a pandemic where every red cent is going out to help people who are, need jobs and everything. But I think it is so important to have a framework up, and I'm eager to look at how it's set up and how it's going to allocate funds, because I think it's really important for us to go to deal with things now as we're meant to deal with them going forward, because more of the budget can be allocated to it in the future. But it should be, it's commendable that they set it up now in the middle of a pandemic, and we need to make sure that this remains one of the bigger priorities as we need to go forward, because if Scotland values all of its people, we need to keep putting our money where our mouth is.
Yeah, we need to show that we are not just talking the talk, but we're walking the walk as well. Well, presumably, Kat, maybe after a new government's been elected, we might see this kind of thing expand. What do you think, that the reality of coming out of COVID, would that, do you think, allow us to do more than they've been doing so far this year?
I think that a lot of things have been pared down out of necessity for COVID. I think that there's a lot of things, they said that the economic hit has been largely shouldered by women during the pandemic. So there will definitely be ways that we're going to have to deal with coming out after the pandemic that are going to have to deal with inequalities in our society. So I do think that this is, Just the fact that they set it up right now, I think is a good sign that this will remain a priority, and I hope it does so.
Okay, thank you very much, Kat. And just moving to our final story this evening. And a game-changing diagnostic tool called a cytosponge helps to resume key services at health boards in Scotland. Launched on the 5th of November in NHS Lanarkshire, Cytosponge is now rolling out across Scotland with 500 patients having already had the procedure. The innovation comes as NHS Scotland's National Centre for Sustainable Delivery works at pace with health boards, National Services Scotland and industry partners to adopt Cytosponge as a part of accelerated programme of innovative technologies to support the resumption of key health services in the wake of the pandemic. The service has now been implemented in 9 health boards across Scotland. The Cabinet Secretary for Health, Jean Freeman, said Cytosponge is a more patient-friendly test than endoscopy that enables faster diagnosis of patients at risk of pre or early cancer and vastly reducing the need to undergo more invasive diagnostic procedures. The scale and pace of the adoption and implementation of this new Cytosponge technology across NHS Scotland is a remarkable achievement. Graham, a remarkable achievement. When I first heard that there was a Cytosponge being rolled out across Scotland, I had visions of a B, horror movie with this giant sponge rolling across Scotland. Had you ever heard of the Cytosponge before this evening?
Absolutely not. And as a complete non-expert on this subject, it sounds like a cytosponging should be better for you than an endoscopy. So if it makes the patient journey and experience less uncomfortable, and the testing allows people to discover any
Yeah.
issues early without too much invasion, that can only be a good thing. But I have to say, I have no idea what it is.
I have to say, neither have I. Kat, are you any the wiser on what Cytosponge is, or is it new to you as well?
It is new to me, but my grandpa died of esophageal cancer
Oh
and
dear, I'm
in his
sorry.
80s, but I do know that he had an inoperable tumor. So they had to go in there and they had to check fairly often, and it was hard on him. And,
Mm.
you know, there's anything that they can do that's less expensive, less invasive, and it's easier on the patients and it's easier to fund, I can't argue with that. I'm really happy to hear that.
Well, I have to say, admit that I have had first-hand experience of endoscopy as from the patient side, and it's a very unpleasant experience having an endoscope passed down into your stomach. And in many cases, people have to be sedated. So I can imagine that this is going to make things a lot quicker when we don't have to have an anaesthetist on hand, Graham, in order to make sure that patients are calm enough for the procedure. This sounds like a much calmer and less traumatic test to go through.
And by the sound of it, if what you've just reported is correct, it's going to pick up cancers perhaps at an earlier stage than they might have done because they're having to do a less invasive procedure to get it. So all around, it works for the patient, it works for discovery of illnesses in time, and it works cost wise. So what's not to like about it?
Sounds good to me. Kat, just to come back to the subject, cancer care has traditionally been one of the 3 big killers. Cancer has been one of the 3 main killers in Scotland. And some people had said that cancer treatment had taken a bit of a back seat to the COVID vaccine, the COVID virus and the treatment of COVID. Do you think perhaps that we're not seeing quite a lot of very important work that's going on in the background into cancer and the effective discovery of it, and this cytosponge just being maybe one of these techniques that are being developed?
Yeah. Well, one thing I do know about President Biden is that cancer research is something that he has prioritized and really, I mean, it's something that because his son died of cancer, it has
Yeah.
been really, really important to him. So I don't think that the research has fallen off at all. I was concerned at the beginning of the pandemic about cancer care. I've talked to a few people. I used to be, I don't do it right now, but I used to be a community volunteer for Macmillan, where I'd talk to people who just needed help accessing cancer care. I haven't done that since the pandemic started, but I have been in contact with people who have like their tests have resumed and everything has gone by. But yeah, anything that makes it easier to treat, easier to stay healthy and to check it, everybody, that's all, nothing bad about that in my book.
Okay, Kat, thank you for that. Well, we've just about reached the end of tonight's programme. We're just about run out of time. But before I leave you tonight, let me just remind you that Broadcasting Scotland is in the middle of its most important crowdfunder so far, in fact. And we want to be there for the rest of 2020 to see you through all the important events that are coming up. And if you'd like to help us to do that, I beg your pardon, I keep saying 2020, I'm just being reminded it's 2021, of course. But if you'd like to help us to be there all the way through 2021 and be there for all these events, you can do so by following the instructions on your screen now and becoming a supporter of Broadcasting Scotland for as little as £5 a month, or you can make an individual donation, or you can volunteer. But by all means, you can do all three if you wish. But anyway, we're just about out of time. It's just enough time for me to thank both my guests, Councillor Graham Campbell and also Carey in Edinburgh. So thank you both very much. And from all of us here at Scotland at 7 this evening, a very good evening to you.
What distinguishes Broadcasting Scotland from a website or blog, apart from our brilliant programmes?
Hi there, I'm Gordon Ross.
Are the costs we face to enable us to produce those programmes. These costs are significant and ongoing. However, our facilities are able to do so much more if only we had the staff. In the last year, some of our supporters have cancelled their subscriptions. In one way, we would prefer it if it was because they didn't like us, rather than it being because of the financial pressures which we are all under because of COVID. The really positive outcome of our fundraiser is that at a time of economic challenge in Scotland, we will use your donations to create jobs and in a small way contribute to improving the Scottish economy. If you want us to be Scotland's independent broadcaster, able to provide an alternative mainstream television platform, then please support us.
Scotland is going to be an independent country.
Just imagine what we could do if we had even 1% of the BBC Scotland channel's budget. Imagine. And then please consider turning your imagination into reality. Please support us if you can afford it.